If you've ever gone to bed feeling fine, but then woken up with high blood sugar, strong cravings, or restless sleep, you're not imagining it. For many people with diabetes or insulin resistance, blood sugar actually rises at night, not during the day. And here's the part most people don't realize. This often has nothing to do with what you ate for dinner. In this video, we're going to break down one specific mineral that plays a major role in nighttime blood sugar control, overnight insulin sensitivity, and even late-night carb cravings. When this mineral is low, your body struggles to keep glucose stable while you sleep, leading to higher fasting numbers in the morning and that frustrating cycle of spikes. But when levels are supported properly, many people notice more stable overnight readings, fewer cravings at night, and better overall glucose control by morning. Let's start by understanding why blood sugar rises at night in the first place and what your body is actually doing while you sleep. For many people with diabetes, the most confusing blood sugar readings don't happen after meals. They happen overnight. You can go to bed feeling fine, eat a reasonable dinner, and still wake up with higher glucose levels than expected. This experience is extremely common, and it has very little to do with willpower or mistakes at dinner. Instead, it's driven by how the body regulates glucose while you sleep. One of the biggest factors behind nighttime blood sugar changes is the body's natural hormone cycle. While you sleep, your body releases hormones like cortisol, growth hormone, and glucagon. These hormones are necessary for repair, immune function, and energy regulation. But they also signal the liver to release stored glucose into the bloodstream. In healthy metabolism, insulin balances this release. In diabetes or insulin resistance, that balance is weakened, allowing blood sugar to rise. Another important contributor is the dawn phenomenon. In the early morning hours, usually between 3 and 8 a.m., the body prepares to wake up by increasing glucose availability. This is meant to give you energy for the day ahead. However, if insulin sensitivity is low, this normal glucose release turns into an exaggerated spike. Many people wake up with elevated fasting blood sugar even though they didn't eat anything overnight. Liver function also plays a major role. The liver acts as a glucose storage and release center. During the night, it decides how much sugar to release to keep the brain supplied with energy. When insulin signaling is impaired, the liver may release more glucose than needed. This excess release raises blood sugar levels quietly while you're asleep, often without any warning signs. Sleep quality itself matters more than most people realize. Poor or fragmented sleep increases cortisol levels, and cortisol directly raises blood sugar. Even subtle sleep disruptions, waking up frequently, shallow sleep, or going to bed very late, can shift glucose regulation overnight. This is why people often notice worse morning readings after a bad night's sleep, even if their diet hasn't changed. Late-night eating can contribute as well, but it's not the whole story. When you eat close to bedtime, especially carbohydrate-heavy foods, insulin has to work while your body is trying to rest. Digestion slows during sleep, and glucose clearance becomes less efficient. This can prolong elevated blood sugar into the early morning hours. However, many people experience nighttime spikes even without eating late, which points back to internal regulation rather than food alone. Stress also plays a role during the night. Chronic stress keeps cortisol elevated, and cortisol tells the liver to release glucose. If stress hormones remain high overnight, blood sugar can stay elevated or rise unexpectedly. This is why emotional stress, anxiety, or irregular schedules often show up in fasting glucose numbers the next morning. Another overlooked factor is insulin sensitivity at night. Insulin does not work the same way around the clock. Many people are naturally more insulin resistant in the evening and overnight. This means the same amount of glucose causes a larger rise at night than it would during the day. When insulin sensitivity drops too low, the body struggles to keep glucose stable while sleeping. All of these factors, hormone release, liver glucose output, cortisol levels, sleep quality, stress, and reduced nighttime insulin sensitivity, combine to make overnight blood sugar control especially challenging. This is why focusing only on daytime meals often doesn't fix high fasting numbers. The good news is that nighttime blood sugar is not random. It follows predictable biological patterns. And one of the most important ways to support overnight glucose control is by addressing key nutrient deficiencies that affect insulin signaling, cortisol balance, and liver glucose release. In the next section, we'll look at one specific mineral that directly influences these systems and why low levels of this mineral are strongly linked to nighttime blood sugar spikes and poor morning readings. One of the most overlooked reasons blood sugar becomes unstable at night is a deficiency in magnesium. Magnesium is a foundational mineral involved in hundreds of processes in the body, but for people with diabetes, its role in nighttime glucose control is especially important. When magnesium levels are low, insulin signaling weakens, stress hormones rise, and blood sugar regulation during sleep becomes much more difficult. Magnesium plays a direct role in how insulin works at the cellular level. Insulin is the hormone that allows glucose to move from the bloodstream into the cells. For insulin to function properly, certain enzymes inside the cell must be activated, and magnesium is required for that activation. When magnesium is low, insulin may still be present, but it becomes less effective. This leads to higher circulating blood sugar, especially during periods when insulin sensitivity is already reduced, such as at night. Another critical role magnesium plays is in regulating cortisol, the body's main stress hormone. Cortisol naturally rises in the early morning hours to help the body wake up, but when magnesium is deficient, cortisol can remain elevated throughout the night. Elevated cortisol signals the liver to release glucose into the bloodstream. This means that even while you're sleeping and not eating, your blood sugar can slowly rise due to stress hormone activity. Magnesium helps calm the nervous system and prevents unnecessary cortisol release, which is why adequate magnesium is so important for overnight stability. Magnesium also affects the liver's glucose output. The liver stores glucose and releases it as needed to keep the brain supplied with energy. In healthy metabolism, this release is tightly regulated. In magnesium deficiency, the liver becomes more reactive and releases more glucose than necessary. This excess release often happens quietly during sleep, contributing to elevated fasting blood sugar in the morning. By supporting proper liver signaling, magnesium helps prevent this over-release of glucose at night. Sleep quality is another major connection. Magnesium is known for its calming effect on the nervous system and its ability to support deeper, more restful sleep. Poor sleep increases insulin resistance and raises cortisol levels, both of which worsen overnight blood sugar control. When magnesium levels are low, sleep tends to be lighter and more fragmented, which further disrupts glucose regulation. Improving magnesium status often leads to better sleep quality, which indirectly supports more stable blood sugar throughout the night. Magnesium deficiency is extremely common in people with diabetes. High blood sugar increases urinary magnesium loss, meaning the body excretes more magnesium through urine. Certain medications, stress, and low intake from food also contribute to deficiency. Over time, this creates a cycle where low magnesium worsens insulin resistance, and insulin resistance further depletes magnesium. Common signs of low magnesium include muscle cramps, restless sleep, fatigue, increased stress, irregular heart rhythm, and difficulty relaxing at night. Many people do not associate these symptoms with blood sugar control, but they are often closely connected. When magnesium is low, the body struggles to maintain balance during sleep, making nighttime glucose spikes more likely. What makes magnesium particularly important at night is that insulin sensitivity naturally decreases in the evening. This means the body needs extra support to manage glucose while sleeping. Without adequate magnesium, the systems that normally keep blood sugar steady become strained. Supporting magnesium levels helps insulin work more effectively, reduces unnecessary glucose release from the liver, and keeps stress hormones from pushing blood sugar higher overnight. Magnesium does not act like a medication, and it does not force blood sugar down. Instead, it supports the systems that regulate glucose naturally. This is why its effects are often gradual but meaningful. When magnesium levels improve, many people notice more stable overnight readings, fewer early morning spikes, and better overall morning glucose numbers. In the next section, we'll look at how magnesium helps diabetics overnight in practical terms, including signs it may be helping, how it affects cravings and energy, and why consistency matters more than quick fixes. Now that we understand why magnesium matters at night, let's look at how this mineral actually helps diabetics in real, practical ways while they sleep. The effects of magnesium are not dramatic or sudden, but they are steady and supportive, which is exactly what the body needs overnight. One of the most noticeable benefits magnesium provides is more stable overnight blood sugar. When magnesium levels are adequate, insulin is able to work more efficiently even during periods of natural insulin resistance, such as late evening and early morning hours. This allows glucose to move into the cells more smoothly instead of lingering in the bloodstream. As a result, blood sugar levels tend to rise more slowly and stay within a narrower range while you sleep. Magnesium also helps reduce the early morning glucose surge that many diabetics experience. When cortisol and other hormones rise before waking, the liver releases glucose to prepare the body for the day. In magnesium deficiency, this release is often exaggerated. Magnesium helps regulate this process by calming the nervous system and preventing excessive hormone-driven glucose output. This is why some people notice lower or more predictable fasting blood sugar readings after consistently supporting magnesium levels. Another important benefit is improved sleep quality, which directly affects glucose control. Poor sleep increases insulin resistance and raises stress hormones, both of which worsen blood sugar regulation. Magnesium supports relaxation by activating the parasympathetic nervous system, the part of the body responsible for rest and recovery. Deeper, more continuous sleep helps stabilize hormones and reduces overnight blood sugar fluctuations. Magnesium may also help reduce nighttime cravings, which are common in people with unstable glucose. When blood sugar drops or fluctuates during sleep, the brain can trigger hunger signals, leading to late-night snacking or early morning cravings. By supporting smoother glucose regulation, magnesium helps prevent these drops, making hunger signals quieter and more controlled. Energy levels in the morning are another area where magnesium plays a role. Waking up with high blood sugar often leaves people feeling tired, sluggish, or foggy. Magnesium supports cellular energy production, which means glucose that enters the cells is more likely to be used efficiently. Over time, this can lead to better morning energy and less reliance on quick carbohydrates to feel alert. Magnesium's effects also extend to muscle relaxation and circulation, which indirectly support glucose metabolism. Tight muscles and poor circulation reduce glucose uptake in peripheral tissues. Magnesium helps muscles relax and improves blood flow, allowing glucose to be delivered and utilized more effectively. This is especially helpful overnight when circulation naturally slows. Consistency is key with magnesium because it supports underlying metabolic processes rather than forcing blood sugar changes. Benefits tend to appear gradually. Many people notice improvements after several weeks of consistent use rather than overnight. This slow, steady effect is actually a positive sign as it reflects improved regulation rather than a temporary spike or drop. It's also important to understand that magnesium works best as part of a broader overnight strategy. Stable dinner choices, consistent sleep schedules, stress management, and adequate protein intake all work together with magnesium to support nighttime glucose control. Magnesium strengthens the system, but it does not replace healthy habits. For many diabetics, the biggest change magnesium brings is predictability. Blood sugar becomes less erratic overnight. Morning readings feel more consistent, and the fear of unexplained spikes begins to fade. This sense of stability can make daily diabetes management feel more manageable and less frustrating. In the next section, we'll cover how to use magnesium safely and effectively for overnight blood sugar support, including the best forms, proper timing, dosage ranges, and important precautions for diabetics and older adults. Now that we've covered how magnesium supports overnight blood sugar stability, the final step is understanding how to use it correctly. Magnesium is a supportive mineral, not a drug, and using the right form, timing, and dose is what determines whether it helps or causes unnecessary issues. There are several forms of magnesium available, but not all of them are equally useful for nighttime blood sugar support. The most commonly recommended forms are magnesium glycinate, magnesium taurate, and magnesium citrate. Magnesium glycinate is often preferred for evening use because it is gentle on the stomach and has a calming effect on the nervous system. Magnesium taurate may also be helpful as it combines magnesium with taurine, an amino acid involved in glucose regulation and cardiovascular support. Magnesium oxide is generally not ideal for this purpose. It is poorly absorbed and is more likely to cause digestive discomfort without providing consistent metabolic benefits. For nighttime glucose control and sleep support, choosing a well-absorbed form is far more important than taking a large dose. In terms of dosage, most studies and clinical recommendations fall within the range of 200 to 400 milligrams of elemental magnesium per day. Many people do well starting at the lower end of this range, around 200 milligrams, especially if they are older or sensitive to supplements. Higher doses are not always better and can increase the risk of side effects without improving results. Timing matters, especially for overnight benefits. Magnesium is typically best taken in the evening, about 1 to 2 hours before bedtime. This timing allows magnesium to support relaxation, reduce stress hormone activity, and assist insulin signaling as the body transitions into sleep. Taking magnesium too late or immediately before lying down may cause mild digestive discomfort in some people, so giving it time to absorb is often helpful. Magnesium can be taken with or without food. Some people prefer taking it with a light evening meal to improve tolerance, while others find it works well on an empty stomach. There is no single correct approach, and individual comfort should guide this choice. Safety is especially important for people with diabetes. Magnesium is generally well tolerated, but it can interact with certain medications. People using insulin or blood sugar lowering medications should monitor their glucose levels when starting magnesium, as improved insulin sensitivity may slightly lower readings over time. This effect is usually mild, but it's important to be aware of it. People with kidney disease or significantly reduced kidney function should avoid magnesium supplementation unless supervised by a healthcare provider. The kidneys are responsible for regulating magnesium levels, and impaired function can increase the risk of accumulation. Possible side effects of taking too much magnesium include loose stools, abdominal cramping, or nausea. These symptoms usually indicate that the dose is too high or the form is not well tolerated. Reducing the dose or switching to a different form often resolves the issue. Food sources of magnesium include leafy greens, nuts, seeds, legumes, and whole grains. However, many people with diabetes struggle to obtain adequate magnesium through diet alone due to increased urinary loss and dietary restrictions. This is why supplementation is commonly considered when deficiency is suspected. It's important to remember that magnesium works best as part of a consistent routine. Irregular use is unlikely to provide meaningful overnight benefits. Supporting magnesium levels daily allows insulin signaling, cortisol regulation, and liver glucose output to stabilize gradually over time. Magnesium is not a cure for diabetes, and it does not replace medication or medical care. However, when used responsibly, it can support the body's natural ability to regulate blood sugar overnight and reduce the unpredictability of morning readings. In the final part of this video, we'll briefly recap the key points and discuss how magnesium fits into a long-term strategy for healthier, more stable blood sugar control. Nighttime blood sugar issues can feel frustrating, especially when they seem to happen without any clear reason. But as we've covered, overnight glucose changes are often driven by hormone shifts, insulin sensitivity, and nutrient balance, not just what you ate for dinner. Magnesium plays a supportive role in this process by helping insulin work more effectively, calming stress hormones, and supporting more stable glucose regulation while you sleep. For many people, improving magnesium status helps reduce overnight fluctuations and leads to more predictable morning blood sugar readings over time. As always, magnesium is not a replacement for medication or medical care. If you have diabetes or take blood sugar-lowering medication, speak with your doctor before starting any supplement and monitor your levels closely when making changes. If you found this video helpful, consider subscribing for more clear, science-based guidance on blood sugar, minerals, and long-term metabolic health. Thanks for watching, and I'll see you in the next video.